Assalamu alaikum. Our lecture today is about professionalism. As you know, as a medical students and healthcare workers, and probably for everyone with any profession, professionalism nowadays is becoming more and more an important term that regulates how any one of us is performing his duties. So there are different definitions for professionalism. One can define it as conducting oneself with responsibility, integrity, accountability, and excellence. Other definition, it's the skill, the good judgment, and the polite behavior that is expected from a person who is trained to do a job well. At the same time, it's an individual's adherence to a set of standards, code of conduct, or a collection of qualities that characterize accepted practice within a particular area of activity. As professionals and healthcare workers, physicians are committed to the health and well-being of individual patients and society through different points. The first one is the ethical practice. The second one is the high personal standards of behavior, the accountability to the profession and the society, physician-led regulation, and finally, maintenance of personal health. Professionalism in medicine requires the physician to serve the interests of the patient and community above his or her self-interest. Professionalism aspires to altruism, accountability, excellence, duty, honor, integrity, and respect for others. Professionalism is an implicit contract between medicine and society. I have a question for you. So we have different scenarios here. We need to know which of the following situations is following a professional way of behavior and which of the following is not. So to look good, neat, and tidy, do you think is this a professional or an unprofessional behavior? Definitely, it is a professional one. Sign the attendance sheet and go without attending the activity because he's busy. So yeah, I think it's unprofessional conduct. Another example, for instance, Dr. Mark, he's a MD, a fellow of the Royal College of Surgeons, is the best plastic surgeon in the Middle East. It's again an unprofessional behavior. Using your female patient information to add them to your Facebook friends definitely is an unprofessional behavior. Avoiding an unnecessary eye or physical contact with your patient of an opposite gender is a professional behavior. So why is knowing about doctor relationships and the duties is important? Are doctors educated to be clinicians only? Are they supposed to be a team member versus a team leader? And who is the most important component in healthcare? Are we providing a patient-centered care? Which means that the focus and the priority is what is in the best interest of our patient at the physical, socio-cultural, and psychological levels. Are we treating sick bodies only? So from this slide, we can know that our patient should be the focus of the healthcare. So our service should be patient-centered. So if you can see from this diagram that doctors, guards, technicians, social workers, nurses, paramedics, managers, and educators are all of them trying to do their responsibilities to give the best care for our patients. To be a medical expert, on the other hand, there are some features and characteristics that you need to have. So you need to be professional, you need to be a good communicator, you need to be a collaborator and cooperative with the other team members. You have to have some leadership characteristics at the same time. You need to be a health advocate. So you are trying to offer the best medical care for your patient. You need to be knowledgeable and a scholar. So we've mentioned before that professionalism is a contract between any healthcare provider and the society. So in these contracts, there are different commitments. So we need to have commitments to our patients. We need to have commitments to our society. We need to have some commitments to our profession, and we need to have commitments to ourselves. So this slide is showing the commitments that you need to have to your patient. So altruism, which means that you in favor your patients on any self-interest. You need to be compassionate and caring for your patients and their families. There should be some professional boundaries between the healthcare provider or physicians and their patients. You need to respect diversity. You need to have integrity and honesty to your patient. And disclosure of physician limitation that can affect care. And probably the best example, for any surgeon, if he can do a certain type of operation, they should not even try to do that operation to any patient. You need to have respect to patient confidentiality, and you need to have a moral and ethical behavior. So I think you need to go over the slide just to have a look over the points that I've mentioned as key competencies and enabling competencies. We have commitments to the society. Different points like commitment to the promotion of the public good health care, the social accountability, social contract in healthcare, social expectation of physicians and the profession. We have commitment to the profession. I mean, accountability to professional regulatory authorities, codes of ethics, commitment to professional standards, and medico-legal framework governing practice. We have commitments to ourselves as healthcare provider, applied capacity for self-regulation, including the assessment and monitoring of one's thoughts, behaviors, emotions, and attention for optimal performance and well-being. Responsibility to self, including personal care in order to serve others, career development, and career transitions. Components of professionalism. So we have different components, starting with altruism, which is the essence of professionalism. It's the best interest of the patients, not self-interest, is the rule. Accountability is required at many levels to individual patient, society, and the profession. Excellence entails a continuous efforts to exceed normal expectations and to make a commitment to lifelong learning. Duty is the free acceptance of a commitment to service. Honor and integrity are the consistent regard for the highest standards of behavior and refusal to violate one's personal and professional codes. Respect for others, patients and their families, other physicians and professional colleagues such as nurses, medical students, residents, subspecialty fellows, and self, of course, is the essence of humanism. Commitments as professional medical student, you need to respect your professors, preceptors, and peers. You need to show respect for guest speakers and visiting patients. You need to give a respect for cadavers and anatomical specimens in the anatomy lab. Respect for the institution of which you are a part. Respect for patients and their families at clinical encounters. Respect for patients' confidentiality. Respect for all members of the healthcare team. Respect for the administrative and the support staff, and finally, respect for the core values of professionalism. Commitments of a professional doctor to professional competence, to honesty with patients, to patients' confidentiality, to maintain appropriate relationships, to improve quality of care, to improve access to care, to adjust distribution of finite resources, to scientific knowledge, to maintain trust by managing conflict of interest, and to professional responsibilities. Lack of professionalism, different scenarios, abuse of power, for example, abuse while interacting with patients and colleagues, bias and sexual harassment, breach of confidentiality. Arrogance, which is an offensive display of superiority and self-importance. Greed, when money becomes the driving force for any physician. Mispresentation, like lying, which is a conscious fail to tell the truth, or a fraud, like a conscious mispresentation of material fact with the intent to mislead. Impairment, any disability that may prevent the physician from performing his or her duties. Lack of constituency, failure to fulfill responsibilities. Conflict in interests like self-promotion, advertising, or unethical collaboration with industry, acceptance of gifts, misuse of services, overcharging, inappropriate treatment, or prolonging contact with patients. How can we teach professionalism? By role modeling, bedside teaching, simulated patients, small group discussions. And I like this saying actually, that we teach our students the ideal, but they will learn from the real. How can professionalism be assessed? So as you can see from this slide, there is a Miller's prism of clinical competence. So if you can see that from a novice healthcare provider to an expert, you go with an upward professional authenticity. So you need to start with the first level to know, and that's a fact gathering. Example, traditional true, false, MCQs. Then you need to know how by doing an interpretation and application through a case presentation, essays, question, extended match type, multiple choice questions. Then you need to show by demonstration of learning, by either simulation or, for example, OSCE exams. And finally, you do it. So you need to perform and to integrate into practice through a direct observation, workplace-based assessment. Again, you need to know, then you need to know how, and then you need to show how, and then you can do it. So you can achieve the first two level by either written, oral, or computer-based assessment. And then when you need to show how, and when you need to perform that task, it's by performance or hands-on assessment portfolios. So how can we assess professionalism? It might be using a peer evaluation, patient surveys, staff evaluation, and self-evaluation through a professionalism portfolio. Evaluation results, we might have minor errors with no consequences and no awareness. Like, for example, a student falls asleep on a stretcher in the hall of the hospital. We might have major errors, serious sequences, and there is an awareness. So student does not answer his pager from the emergency room. And we have the critical events with serious sequences needs immediate action by the supervisor, like student hitting a patient. So as a conclusion, being a doctor is about being part of a team. You have rights and you have duties as part of this team. Your patient is the center of the healthcare, not your ego and not your bank account. Many of the positive attitudes and skills can be developed through training and self-development. Developing and adhering to these standards develops you and your personality. It improves healthcare and enhances public trust in the health system. By respecting your patients, colleagues, and the community in general, you build better relations and a better reputation for being a faithful model doctor.